today. Unfortunately, we had no sign language interpreters available for today. So we will have a video of this press conference available tomorrow with ASL interpretation. Just wait for the ambulance to go by. The latest COVID numbers, I'll start with the state and then go into the city. Confirmed cases as of yesterday, Monday, 1,166 new cases in Massachusetts, bringing the total 218,329. There were 25 new deaths reported yesterday, bringing the total of deaths in Massachusetts to 10,512. In Boston, the numbers are today's numbers. We had 407 new confirmed cases. That's a total of 27,635. We had no deaths registered, but since Friday we had 11 deaths reported. Our total deaths in Boston is 919 from the beginning of COVID-19, and we continue to pray for the families who are struggling, people struggling with COVID-19, and the families that lost loved ones. We want to know that you're in our thoughts and prayers. Testing data for the week ending November 23rd, we had an average of 4,860 tests each day compared to 4,200 the week before. So we've seen significant increase in testing in the last month here in the city, but in particular on 1 week, 660 new tests, which is good. This does not include college testing going on right now in the city. It does reflect the strong demand for testing ahead of the Thanksgiving holiday. So we're encouraged and thankful that everyone that got tested, and we want to urge everyone, even though you get tested before Thanksgiving, it's important for you to get tested after Thanksgiving as well. So we urge you, if you were in large gatherings or any place that you might have been in contact with public people that you didn't know, you should get tested. Currently, we have over 30 testing sites in the city. You can find them listed on, you can go to boston.gov/coronavirus, or you can call 311 to get testing locations in your neighborhood. We continue to expand our testing capacity, especially with the communities with the highest rate of infection. Our free mobile testing sites this week are we've been in East Boston for several weeks now, Central Square Park in East Boston, and then we're also in Washington Park Mall in Roxbury at the corner of Martin Luther King Boulevard and Warren Street. I'm also announcing a third mobile test site this week. It will be operating through Thursday in Jamaica Plain at Anna Cole Community Center in Jamaica Plain. It's open from 3 p.m. to 7 each day to provide more access for people who are working and have a chance to go get tested after work. We continue to urge employers to be flexible and provide time for folks. So if people are asking, we're asking you to allow your employees go for an hour of the day to get testing if they want to get testing. Also a reminder, our mobile testing sites are free and open to anyone, regardless of whether you have COVID symptoms or not. So the 3 mobile sites, you can go, just set up an appointment and go get tested without any type of symptoms. The percentage and the positivity for the week ending November 23rd, the average number of positive tests each day for Boston residents was 183. That's down from 252 from the previous week. Our current community positive rate was 3.4%. That's down from 5.4% from the current week. No neighborhoods had a positivity rate over 8%. Dorchester, East Boston, Hyde Park were over 5%. Every neighborhood saw positivity rates go down in this last week's 7-day average, which is good to see. So in 2 weeks leading up to Thanksgiving, our numbers went in the right direction. We may see increases with the impact of the Thanksgiving holiday, and that's why it's important for us to get testing to see exactly if there has been any spread of the virus during Thanksgiving. You heard me report a large number of cases today, over 400 new cases. We're going to be monitoring the data closely as it comes in to make sure that we don't see these large spikes. That 400 number has been the largest, honestly, I think, since June. We haven't had a day that big, so we're going to, tomorrow and the next couple of days, see what the numbers look like. In the meantime, we have to continue to do everything we can to stop spreading the virus. We're going to keep providing testing resources along with health and safety guidelines. And we also need everyone to take your personal precautions as serious as ever as we move into this holiday season. We're asking people to cover their mouth when they cough, wear a mask or face coverings when you're in a public space or when you're walking. That's an order by the state. Wash your hands with soap and warm water frequently. We're asking people to use hand sanitizer, but the best way obviously is soap and warm water as often as possible. Clean and disinfect your surroundings. Touched areas that are often touched areas, door handles, doorknobs, car doorknobs, door handles. If you go shopping, quite honestly, if you can wear gloves, wear gloves. So when you're pushing the shopping carriage, I know some supermarkets have a little cloth to clean it, but just to give yourself as most precautions as possible. We're also asking you to take precautions in the workplace. Don't assume it's your home. Even though it feels like an extension of your home, we're asking you to be very careful there because you don't know when people coming in, like cleaning and other people where they've been. So we want you to make sure you take all of that very seriously. If you are an employer, we're asking you to make sure that your workers have what they need to be safe. Allow people to work from home if possible, something that we'd like to see happen certainly for the next few weeks here in the city, as we're seeing these numbers fluctuate a little higher than we'd like to see them. If you have a reason to think you've been exposed to COVID-19, we're asking you to get tested right away and self-quarantine. And that's I know the rules are changing on self-quarantine. Some people are saying 10, some people are saying 12. I would suggest you self-quarantine for 14 days if you think you were exposed to somebody with the coronavirus. We're also going to continue to provide support for residents and small businesses impacted by COVID-19. Today, I just want to remind everyone of free food resources that we have available. There have been reports across the country about food pantries struggling to keep up with the demand. I want to assure everyone in Boston that our food access system is resilient and it's going strong, and we're going to continue to make sure that we support all of our food pantries around the city of Boston. The staff and volunteers at these sites have been working hard, and I just want to thank them all for their work because they have not stopped at all from the beginning of this pandemic and actually have been working even harder during this last week with the holiday. We're in constant communication with our key partners like the Greater Boston Food Bank and other food pantries around the city of Boston to see if we can be helpful to them in any other way. We continue to provide support through the resiliency funds to fill the gaps that are arising in these different places. We currently have 58 active youth meal sites in the city of Boston. You can pick up multiple meals at one location for anyone under 18 years old. No ID is necessary, and children do not need to be present. These sites will remain open through the winter. These locations include 26 Boston Public Schools super sites where you can pick up 3 meals in one trip for your child. We're working on making sure that these sites can provide groceries as well as packaged meals, I should say, as we move forward here. In addition, families of Boston Public School students are entitled to a pandemic EBT card issued by the state for buying food and groceries. If you have used your card already, please hold on to it. We expect more funds will be added to these cards in the coming month. We also have Double Up Food Bucks program, which provides 50% off of produce bought with SNAP benefits at local markets. If you are a store owner and like to participate, please contact our Office of Food Access by emailing food@boston.gov. For more information on these resources and all the resources we have, as well as maps and meal sites, visit boston.gov/food. That's boston.gov/food. All that information is there. There's also a reason that demand for food assistance has gone up. This pandemic has caused severe economic pain and heightened inequities all across the city. Many people are out of work. Many people are dealing with the virus in their own family, and they're going into quarantine. It has devastating effects on many of our families and households, especially in our communities of color here in the city of Boston. We want to be there for everyone who needs it, and we want you to know that help is available. I talked about our food resources today. I talked last week about new grants for the Boston Resiliency Fund, supporting organizations that do this work in our communities. We continue to have our $8 million renter relief fund available at boston.gov/renter-relief. So if you're concerned about being evicted from your home and you don't have the money, contact the City of Boston, the Office of Housing Stability, so we can help you with the rent relief application. Today, we're also announcing a new resource to help you deal with economic stress brought on by the pandemic. It's called the Financial Navigator Program. The way it works is you get free half-hour phone consultation with one of our navigators. They are trained to help you access the relief and services that you need. There are many programs out there right now designed for the needs that residents are currently experiencing. But too many people are not aware of these programs or don't even realize they exist. The navigators can help you with that. They can also help you untangle some of the financial chaos people are facing right now and help you make a plan to move forward. You can access the financial navigators by completing a form available on the OFE at boston.gov, which is our Office of Financial Empowerment. You can also call 617-356-8229 to sign up for help, or call 311 and ask about our Financial Navigator program. In addition to English, the Financial Navigator program is available in Haitian Creole, Spanish, and Portuguese. I also have some good news to share today about the city's finances during these very challenging times. Last week, both of our credit rating agencies assigned Boston a AAA bond rating with a stable outlook for moving forward. What the AAA bond rating means is, because we have taken good care of our finances, our credit is trusted as the best in its class. We can get the lowest borrowing costs, and we can invest in more of our neighborhoods than ever before. 2014 was the first time Boston received a perfect AAA bond rating from Moody's and Standard & Poor's. By growing our economy and carefully managing your tax money, we held on to these perfect bond ratings every single year since then for 7 consecutive years. This year, obviously, it's a much tougher economy. We have maintained this strong fiscal position. In fact, we're named in the National Tax Journal and the New York Times as the city best prepared to withstand the COVID-19 recession. That's an outstanding achievement, and I want to thank our Chief of Administration and Finance, Emma Handy, our Budget Director, Justin Starrett, and our Head of Treasury, Drew Smith, and all of their teams for the incredible work that they do. What this work means for our residents, it means that we'll be able to invest more of our resources in affordable housing as we move forward here, in climate resilience, open space and parks, in new schools and neighborhood libraries, in safe streets, bus and bike lanes, all the infrastructure that supports the quality of life in the city of Boston and helps families build their dream around this great city. So I want to thank you. This year, we responded to the immediate, urgent needs of our residents. At the same time, the long-term work allows us to build a resilient and equitable recovery here in Boston. It's why our upcoming bond sale will feature Boston's first ever series of green bonds and first ever series of social bonds. Green bonds will support energy efficiency investments in city buildings and eliminate climate adaptation, in our public spaces. The social bonds will help us support affordable housing being built around the city in multiple sites. We'll be releasing more details about the bonds and these projects later today, so I just want to give you a little teaser on that. Finally, today is Tuesday after Thanksgiving. That means it's Giving Tuesday. This year, the needs of our community are greater than they have been in quite a long time. At the same time, the opportunities to help meet those needs are more numerous now than ever. Many nonprofits and community organizations are doing incredible work in our neighborhoods and have continued to do that work throughout the entire pandemic. In most cases, the work's being done by people in the community who know the community and reflect the cultures of our different neighborhoods here in Boston. We have gotten to see up close throughout the year the work that's been done by the Resiliency Fund grantees, all the folks that got money from the grants, and the incredible work they've been able to do to keep our city safe and open. Since April, the fund has delivered over $29 million to 350 nonprofits that serve their neighbors with COVID testing, with food, with gift cards, with home learning technology, and so much more. But there is much more work to be done as the work continues. So I encourage you, if you can, to help out local nonprofits that are doing this work. You can learn more about the nonprofits doing the COVID relief work at boston.gov/resiliency fund. And I also asked some of the companies in our city that have been often philanthropic donors to a lot of these nonprofits, if you could please stay connected with them, these organizations. They need your help now more than ever to make sure they can continue the work. The work that they do has not stopped. So we need to make sure they support that they survive this pandemic as well. We're also entering the holiday season, and that's a tough time for lots of families. This year, more families are struggling to meet their basic needs like food and rent. Buying toys and gifts is going to be beyond reach for many, many families here in the city of Boston. That's why one of our most meaningful partners at this time of year is Toys for Tots. It's an annual toy drive led by the U.S. Marine Corps. We work with Toys for Tots because we don't want any child or any family to be left out of the holiday joy. We can't have in-person toy drives as we usually do this year, So we all need to work harder to make sure everyone we can, so we can reach children and families throughout the city of Boston throughout this holiday season. We're going to have locations all across our city where we can drop off new unwrapped toys, including in most of our city buildings. And there will be other ways to support the efforts. I'll be sharing more about these opportunities later this week and all month, so I'll be able to ask you, I think the next press conference, Toys for Tots might be here to actually talk about what their plan is this year. It's also a good time to give, if you can, because you're doing something for others. It's often the best way to deal with stressful times. We are feeling some degree of stress these days. There's no question about it here in the city, in the Commonwealth, and our country. It's December 1st. We are 9 months into the pandemic. We have the winter ahead of us. There is light at the end of the tunnel, but there's lots of work to be done before we get there. And I know in Boston we can do it. We are a strong and compassionate city. We support each other. We stand with each other. We help each other. We lift each other up when we fall down. So I want to thank everybody. I had an opportunity on Thanksgiving just to think about where we are and where I am in my life as far as thinking about this past year. And I'm extremely grateful for people who help the most vulnerable in our city. I'm grateful for the people that set up food pantries around the city of Boston. I'm grateful for the first responders. I'm grateful for the nurses and doctors. I'm grateful for the janitorial staff in our hospitals and in our buildings, keeping our buildings clean. I'm grateful for the press, the communication that you've given people over the last 9 months to keep them safe. I'm grateful for the teams here at City Hall, the staff who've done amazing work. That gratitude, you have to keep that in our heart. So when you think you're down, you're going to remember all the great acts of kindness that people in the city have shown people over the last 9 months. We are getting there. We need to continue to support and rally around each other. We need to continue to support each other. And that's how we will get through this pandemic. So I just want everyone just to dig deep to make sure that the people that we love and the people that need help, that we're there to help them. Before I end, I guess I'm going to end there because no questions from the press. I'm going to open up to the press.
Restaurants close. How concerned are you that more of them are going to close and it's going to further that pain economically? And then, aside from that, you did the state shifting the curfew 9:30. We know some restaurants have said that's still the business.
So there's two questions. One is, I'll start on outdoor dining. Today, actually yesterday was the last day for outdoor dining in the city of Boston. If you have private property, you can't extend outdoor dining on private property, but we need to be able to, as the winter's coming, I love, if we had 60-degree weather all through wintertime, we had no snow coming, then we could have outdoor dining all year round. Unfortunately, we can't do that, but we are working on a plan now, an aggressive plan to come back strong in April with maybe even some new and improved additions to outdoor dining, and we're going to be working and unveiling those out as we move forward here. As far as the curfew, ending the curfew, I don't recommend ending the curfew at this particular moment. We have 400 cases today, new cases from yesterday. We did have seen 2 weeks of lowering numbers, and I think that if we can get through the next couple weeks here and have our numbers go in the right direction, then I would recommend that we could lift the curfew. But right now, it's not the right time to lift the curfew. You can't lift the curfew on 1 or 2 weeks of good numbers. You have to do it a little further. I think the curfew is having an impact on keeping numbers down. Or otherwise we could lift it. I do think it's having an impact.
Vaccinations are coming. The CDC is considering right now by the end of the month, the general population will not be spring. But there's certain segments of the population that don't want to perhaps get the vaccination. And I guess I wonder if that sort of surprises you. And if the city has any sort of plans to sort of some sort of public awareness campaign to encourage people to get vaccination.
Yeah, great question. The question is, people watching at home, it's about the vaccine. Some people have made statements they don't want the vaccine. Are we going to be doing a public awareness statement around the vaccine? I think first and foremost, the vaccine is something, it's your individual choice. Personally, I will be getting the vaccine when it's available to me. I think it's important. Obviously, as long as the vaccine CDC guidelines come out and my public health experts say that it's safe to take the vaccine, then I'll take the vaccine. I think a lot of people should be looking for that guidance. And right now, there doesn't seem to be a question about is the vaccine going to be safe. It's kind of when is the vaccine going to be out and what version of the vaccine. There's going to be a couple different versions. I think that we will be talking about a public awareness campaign at the appropriate time. It's still unclear when the vaccine will be here. I mean, some reports will be here by the end of December. Some reports will be here by springtime. Very few reports that it'll be here by the summer, will be here before the spring. We're still trying to figure out who's going to get the vaccine first. I'm hearing it's first responders and nurses and doctors might be the first to get it, who are on the public. So once we get through an understanding of what the timeline for the vaccine to hit the streets are, we will be doing a public awareness campaign. We have to. I think that the vaccine is something that, if it can prevent coronavirus, and certainly I heard a report last night, one of the vaccines significantly reduces the danger of the virus if you do get the virus. So we're gonna be monitoring that and get all that information up to people as we move forward.
Earlier this week, Dr. Fauci was advocating for municipalities to open up their school districts when they keep it safe.
Yeah, when they're safe, he said? Okay. The question is, Dr. Fauci said that when it's safe, that encouraging districts to open up their schools when it's safe, and I agree with that. I mean, it's certainly something. I would love to have schools open right now. I mean, I would love to have our kids in schools right now. I mean, the loss of education by not being in person, we don't know what the impacts will be right now. We probably won't know for a year or so. I think they're going to be pretty detrimental in some ways, and I think we have to be creative on how do we close learning gaps of kids being out of school since March 16th of this year. Right now, we have our highest needs students. We have about 170 of our highest needs students. We're trying to get some more of our highest needs students into classrooms. I'm hopeful that in the course of the next couple of weeks, I'll be able to stand here with a plan on how we're going to reopen our schools in Boston. I'm not anticipating our schools reopening fully before Christmas, the Christmas break. But I'm expecting that we'll be able to have some clarification on what the phased reopening is going to be after Christmas, and that's my goal and my intention. I think that some of our private schools are open, and they're being very successful by being open. The difference is that they're dealing with one school, and they're dealing with one set of rules. And when you're dealing with a district like Boston, you're dealing with 120 plus schools. You're dealing with different grade configurations. You're dealing with transportation challenges. So I think that certainly our school department is working hard right now to figure out, as we open schools, what are some of the safety requirements we can put in place to make sure we can open schools safely. But I know that there are parents all across the city. There's going to be parents here tomorrow, I think, on City Hall Plaza saying reopen schools. I support you. But right now, today, we are not prepared for that. Not when you have 400 new cases today. And I think that as we continue to move forward, if we get these numbers down and we set benchmarks, and we're below those benchmarks right now, we will begin the process of hopefully reopening schools right after the new year, hopefully.
Going off of that, I mean, you mentioned that 400 cases, or you said that's higher than
Yeah.
What do you think?
Well, yes, it could be because of Thanksgiving. It could be the first signs of what Thanksgiving holiday brought, and we always knew. I mean, Dr. Fauci also said he asked people not to travel and stay home, and and millions of Americans traveled all over the place. And he asked people this Thanksgiving, the best thing you could do for Thanksgiving is to stay in your little circle. Lots of people couldn't do that or didn't do that. So we just have to see what's going to happen now. And I think over the course of the next 5 to 10 days, we'll know exactly what the impacts, if there are any. I can't count the 400 all of Thanksgiving, but I'm sure it has something to do with it. In the next 5 to 10 to 15, 14 days, we'll know what the impacts of Thanksgiving were. And hopefully, there's none. And if there's none, then it'll be great. But unfortunately, I think there will be some. We're not sure what that number looks like.
Anything you're particularly looking at? Case counts?
Hospitalization. We're watching hospitalization really closely. What we're not seeing the activity in hospitals that we saw back in April and May. We are seeing activity in hospitals, but not the same. And that's really the big number. That's the difference between keeping a restaurant open and shutting a restaurant down. That's the difference between keeping a business open and shutting a business down, is the hospitalization. If we get to a point where our hospitals are over capacity, where it's infecting other illnesses that people get treated for, that's when we'll be having unfortunately having a very different conversation here. And that's what's happening in other parts of the country. If you watch any of the national news stations or read the papers here, you're seeing what's going on in the Dakotas. You're seeing what's going on in Florida. The fact that the governor of Florida has not issued a mask order and the cases going through the roof, there's nothing wrong with wearing a mask. he's keeping people safe. So in those hospital emergency rooms and a lot of those places, I can't speak for Florida, but I know in Dakotas and other places, they're at capacity and they're over capacity. And we experienced that here in Boston. That's why we built Boston Hope. So we don't want to go back to that day again. All right, everyone. Thank you.